Hello, hi, my name is Lauren, and I'm going to be doing the gluteal region of the leg, and this is going to work on abductors. These are abductors and also rotators of the thigh. So first here on this lovely specimen, this guy's in the way, but yes, we have the gluteus maximus, and so it's really easy to identify, and the proximal attachment is the ilium, real easy, and the distal attachment is the iliotibial tract as well as the gluteal tuberosity. Now for the action, the main action, it extends the thigh. So all this glorious thigh right here. So as we lift it up, usually on the body you were going to see the medius. However, on this figure here, all of a sudden it just goes to the minimus. So I'm supposing the medius is in here somewhere, but I'll just talk about the medius, but it's not necessarily right here. So the medius, its proximal attachment is the ilium as well, and it is between the anterior and posterior gluteal lines. And don't you know, the distal attachment is once again the greater trochanter of the femur. And the main action for the gluteus medius is they're going to abduct and medially rotate the thigh. Okay, so next we have the gluteus minimus, and the gluteus minimus is also proximal attachment is the ilium between the anterior and posterior gluteal lines, and this distal attachment is the greater trochanter. As you can see here, it's actually really evident, and also main action abduct and medially rotate the thigh. Okay, after that we're going to have the piriformis, which is number 13. And right underneath we have the wonderful sciatic nerve, and so that should be really easy to identify on your body. And then, okay, so the piriformis. The proximal attachment for the piriformis is the anterior surface of the sacrum, and the distal attachment is the greater trochanter of the femur. Yes, and the action that it does, it laterally rotates and extends the thigh. Now we're going to look at the obturator internus. Well, first let's look at superior gemellus. Superior gemellus is right underneath the piriformis, and it's right underneath the sciatic as well. The superior gemelli is going to laterally rotate. Okay, thank you. So this is 14, superior gemellus. Proximal attachment is going to be the ischial spine. And the distal attachment is going to be the medial surface of the greater trochanter. And the main action for the superior gemelli is going to be to laterally rotate and extend the thigh.
Is the biceps femoris on the lateral or medial side?
You're asking me right now? Yeah. Well, the biceps, where is this? The biceps femoris, I know this is the tendinosus, this is the membranosus, and this is medial, so
that's the
biceps
femoris.
No, this is semi-tendinosis, this is semi-membranosus, and this is biceps femoris.
Yeah.
Are you asking me about the biceps femoris?
Yeah.
This is the biceps femoris right here.
Head?
Long head, and then this should be the short head.
Great. That's all I need to know. Thanks,
Thank you. Okay, I don't even remember where I was. But let's go to obturator internus. It's in between superior and inferior gemelli. So this 15 guy right here is the, yes, obturator internus. And it is, proximal attachment is going to be on the, it's going to be the obturator membrane and surrounding bones. And its action is also laterally rotate and extend the thigh. Then you have the inferior gemellus. Its main action is going to be to laterally rotate as well. Its proximal attachment is going to be the ischial tuberosity, and the distal attachment is going to be the greater trochanter of the femur. And then underneath that, number 17, we have the quadratus femoris, and its proximal attachment is the lateral border of the ischial tuberosity, and its distal attachment is the quadrate tubercle. So think quadratus femoris. So the distal attachment quadrate again, so quack, yes. And this action is going to be to laterally rotate. And lastly is the tensor of the fascia lata. Tensor of the fascia lata, its origin or proximal attachment is the ASIS, anterior superior iliac spine. and its distal attachment is going to be the iliotibial tract, which makes sense. And then the main action is to abduct and immediately rotate the thigh. So this concludes the gluteal region. You noticed a lot of the proximal attachments were the ilium between the anterior and posterior gluteal lines. So when in doubt, you can put that. And the distal attachment usually was the greater trochanter. So yes, it was fun. Hope you learned a lot. Look at it on the body though. Yeah.